Hello everybody and welcome to Luxury Benefits channel. My name is Sviatoslav and today we will talk about how eyesight works according to German doctor Helmholtz. What is myopia and hyperopia according to Helmholtz, and how does a person really see Bates theory? How eyesight works according to German doctor Helmholtz? About 180 years ago, German physicist and physiologist Hermann Helmholtz suggested that the human eye has the shape of a ball. In the front part there is a lens, a biconvex lens, and around the lens is so-called circular ciliary muscle. So how does a person see according to Helmholtz? When the ciliary muscle is relaxed, the lens is flat. The focus of the lens is on the retina, and such a relaxed eye with a flat lens perfectly see into the distance, because a clear image of a distant object according to the laws of geometric optics is built in the area of the focus of the optical system. In this case, a clear image of a distant object will be just on the retina of the eye, but a person needs to see up close. To see up close, you need to change the parameters of this optical system, and Helmholtz suggested that in order to see up close, a person strains the ciliary muscle. It compresses the lens from all sides. The lens becomes more convex, changes its curvature. The focal length of the convex lens decreases. The focus goes into the eye, and such an eye with a convex lens sees perfectly up close, because a clear image of those close to them by the subject according to the laws of the same geometric optics is built behind the focus of the optical system. In this case, the image of these close objects will again turn out exactly on the retina of the eyes. When a person needs to see into the distance, he blinked, relaxed the ciliary muscle, the lens is flat, he sees into the distance. It is necessary to see it up close, it strains the ciliary muscle. The lens is convex and it sees up close. What is myopia according to Helmholtz? Some people have a strains in ciliary muscle. The lens become convex, but this muscle doesn't relax back. He called it a myopic convex lens. They see well up close, but they don't see it into the distance, because a clear image of a distant object is built in the focus area of the optical system. In this case, the clear image will be inside of the eye, and on the retina there will be some kind of unclear, blurry spot. And then Helmholtz proposed to compensate for myopia with a biconcave negative minus spectacle lens, and the focal length of the system, concave lens plus convex lens, increases. With the help of glasses, the focus is returned to the retina of the eye, and myopic people in minus glasses can see perfectly into the distance. And since then, 180 years ago, all eye doctors in the world for myopic people choose minus glasses and recommend them for constant wear. What is hyperopia or farsightedness according to Helmholtz? Many people, Helmholtz believed, the works of the ciliary muscle weakens with age. As a result, the lens is flat. The focus of the lens is on the retina, and classic farsighted people see perfectly into the distance. But here you have to see it up close also. To see up close, you have to squeeze the lens, make it convex, and the muscle doesn't have enough strength to squeeze the lens. And the person look into the book, and a clear image of the letter is built behind the focus of the optical system, somewhere closer to the back of the head, and on the retina there will be just this unclear blurred spot. And then Helmholtz proposed to compensate for hyperopia with the help of a biconvex plus spectacle lens. And the focal length of the system, convex lens plus a flat lens, decreases. With the help of glasses, the focus is brought into the eye, and farsighted people in plus glasses can see well up close. And since then, 180 years, all eye doctors in the world for farsighted people choose plus glasses, recommended them for reading and for working in a close distance. Dr. Bates. Well, it would seem that it's a trap. You cannot get away from the glasses. But to our happiness, there lived a wonderful American scientist, Professor Ophthalmologist William Bates. Bates was a very honest man. After graduating from medical school, he worked as an eye doctor for 5 years and was horrified and desperate at the result of his work. Every patient to whom Bates prescribed glasses had deteriorated vision from the glasses. None of his patients had their vision after wearing glasses returned, and he asked himself the question, well, how is that? He's an eye doctor, he must treat people's eyes, and he prescribes glasses for them. And their eyesight is getting worse and worse from glasses, and after 2 or 3 or 4 years, they come, demand new, thicker and stronger glasses. And the second thing Bates drew attention to is that some of his patients in the summer went to the countryside, to the mountains to rest, and there they accidentally lost or broke glasses. And he lived in the 19th century. Glasses were quite expensive, and people with poor eyesight were forced to do without glasses for a month or 2. When they returned from this rest, they came to him for glasses. He checked their eyesight according to the table and was surprised to note that many, due to the fact that they walked without glasses, their eyesight began to improve. Bates studied the human eye for 30 years. He developed and manufactured a device unique for its time, which he called the retinoscope. With the help of a retinoscope from a distance of up to 2 meters, he could determine the parameters of the eye, and he watched how the vision changes in the nearsighted, farsighted, and children during the game, in athletes. And so, studying the work of the human eye for 30 years, Bates came to the conclusion that Hermann Helmholtz's theory of vision is incorrect at all. The image in the human eye is not constructed in the way that Helmholtz suggested due to the work of the ciliary muscle and changes in the curvature of the lens. And the image in the human eye is constructed in the same way as it's constructed in an ordinary simplest camera, by changing the lens of the eye itself. And here the main work in the process of accommodation, that is, aiming the eye at sharpness, is played by the 6th oculomotor muscle. Each person has 6 oculomotor muscle in each eye. This is upper, superior rectus, which lifts the eye up. This is the lower, inferior rectus, which lowers the eye down. The inner lateral rectus, which brings the eye to the nose. The outer medial rectus, which leads the eye to the side. And 2 very important, the inferior oblique and superior oblique muscles of the eye. The upper superior oblique, which feeds the eye across in a semicircle from above, and the lower inferior oblique, which in a semicircle from below. So how does a person really see? When all 6 oculomotor muscles are completely relaxed, the eye really takes the shape of a ball. Due to internal pressure, the focus of the lens is on the retina, and such a relaxed eye sees perfectly into the distance. But to see up close, you need to change the parameters of this optical system, and it turns out that in order to see up close, a person actually does the following. Relaxes the superior, inferior, medial and lateral rectus muscle and strains the upper and lower inferior oblique and superior oblique muscle, squeezes eye from above and below, and the human eye is liquid. Due to this compression, it is pulled forward like a cucumber, like a camera lens. The focus goes into the eye, and such an outstretched eye sees perfectly close. A person needs to see into the distance again. He blinks, relax the oblique muscles, tighten the superior, inferior, medial and lateral rectus eye muscles. The eye again takes the shape of a ball, and he again sees perfectly into the distance. Thanks for watching this video to the end. Today we discussed how eyesight works according to German Dr. Helmholtz, what is myopia and hyperopia according to Helmholtz, and how does a person really see, and Dr. Bates' practical knowledge about it. I hope it was interesting for you and it will help. Subscribe to my channel and we'll see you again.